Good evening, sir. I'm happy to present a note on our hospital and our social outreach activities with special reference to the project Hope After Fire. If you really have to take how we grew, I should really thank our parents who, from the very beginning of our lives, they taught us the value of the values and asked us to aim for more. And then my father was a doctor and who started a small hospital in 1978 with 17 beds. And my brother and myself, we were trained in India, and then I was trained in the UK and USA, and we came back in 1991. At that time, we made it into a 35-bed hospital and four operating rooms, and we made it an exclusive center for plastic surgery and orthopedics. And because we introduced microsurgery and for other reasons which I am going to tell, we grew very fast. And in 6 years' time, we built the next block and then we became 135 beds. And in 10 years, we had to move out because our patient strength was very high. So we moved out to another place in 2007 with 420 beds with 17 operating rooms. And in 2020, right now, we are 650 beds with 36 operating rooms. And what really distinguishes is this is primarily for only two specialties of plastic and reconstructive surgery and orthopedics. And we have 36 operation theaters with 85 anesthesiologists and 8 operating rooms run for 24 hours. And our whole work is based on 4 A's. First is availability, then affability, being nice to people. The third is ability. And most important, we have become affordable. In 2024 and 25, we operated around 34,000 surgeries and about 2.5 lakh of outpatients we see, so that it says that about 100 operations we do per day. And how did we grow? How did we grow? The scenario in 1991 was when we came back, we wanted to start a very major hospital, especially for trauma. And I realized that nobody gets injured with money in the pocket. Then how do you reattach the amputated hands or legs, which need to be done immediately? At that time, there are no credit cards, no mobile phones, no pages, and you just have to do. So we started doing things without getting any payment. And thus started the system of nobody pays on arrival when they come with an accident to our hospital. And still, that disruptive innovation continues, and nobody pays on arrival. Everybody gets what they need, and without asking any questions. So this, and also we started a system of variable pricing. So if a surgery should cost about 1 lakh, and if you could afford only 60,000, we still did it. And we gave this system of power of financial independence to the person on call. He only has to note it down in a place as what he quoted or what he agreed. And at the end, we, without compromising quality, we charged him only this thing. So we scaled very rapidly, and that's the reason why we grew. And this has been a business case study of Indian Institute of Management, Bangalore, and it also has been published as in 4 volumes as a Harvard case study. And our institution also became very popular, and it became a center for teaching and training. And about more than 3,600 surgeon visitors have visited our unit, a record for any unit in our country. And people from 167 cities of India have visited our center. Our vision, the most important word that we put, what we put in 1991 was we wanted to become a center which will be the pride of our country. And our mission was that our expertise should be available to every citizen of our country. In that way, we had a lot of projects. And one of the projects is for burns, which I am going to detail. So the healthcare scenario in the country, I think what is really problematic, this was my original idea, that is there is so much of need, but then availability there may be a gap between need and availability. But unfortunately, there is also a gap between availability and utilization. If we have to fill the gap between need and availability, that means it's only government can do that because it requires building hospitals, capacity building, finding resources and all that. But whereas the second gap, that is between availability and utilization, I think people like us can do it. Doctors can, if they really want now, they can do it. And that's what now we have been trying to do with these projects. We got now so many projects, apart from Hope After Fire. We got for breast cancer, we got the Project Shakti. For diabetic foot, we have got a Walk for Life. For cleft lip and palate, we have partnered with Smile Train. But I'll just detail about the Hope After Fire. So, what is this Project Hope After Fire? It's a project to provide free reconstructive surgery to people affected by post-burn deformities. One of the key important thing is it's skill intensive, it is labor intensive and resource intensive, and that's the reason it is a unique project. Let me give you some examples of what we do with this project. The story of Nancy. Here is a young lady whose legs have been strapped together because of the burns. It has got stuck together. It may look to be a simple picture, but then if you think closely, this lady cannot walk and her hands are also very bad. So just imagine if she, how shall she go to toilet? How will she take care of a monthly period? So I think if you really think it's really very, very, very awful life. The same lady, after we treated her, I think that's the situation like this. But then between the two slides, I think what went through was this. After 2 months of working, I think we were struggling. I think we reached multiple stages. We reached a stage like this, and where two of the physiotherapists keep helping her to take her first steps. And after another 3 weeks, she goes to this level. And after some more time, after 3 weeks, she now without two assistants, now with one assistant, she walks. Later, without anybody, she walks. And finally, by 6 months, now she's able to walk. About 5 months it takes to walk. The cost of care is about 8 lakhs, but then it's totally free to the patient. She didn't pay 1 rupee to the hospital. The next is the story of Babu. I think this was his face before, but then he got to fire when they burnt like this. And he came from the hills of Kuno near Uti. And then his hand was like this. Technically, treating his hand is more difficult than treating his face. And that's the other side of his hand. The only one his mother could see him. They really couldn't take him to a hospital because it was so bad. And many times they was refused given dates and they never came back. And there's the same patient, after we treated him. I think total cost of treating is both his face, which also involved microsurgery, and his hands is about 10 lakhs, but it's totally free to the patient. The journey so far has been we have treated 941 patients and they had about 1,700 surgeries. The cost value of the project is about more than 13.7 crores, which is one of the highest value project in the whole country for burn deformities. Rotary Club of Metropolis gives the cost for the subsidized hospital fees, and the surgeon does free, and I operate them free, and then the anesthetists get 50% of their regular fees. I think that our contribution is about 5.5 crores, and then the Rotary's contribution is about 8.2 crores. And that's the distribution of the patients. And we got patients as far from Uttar Pradesh and Manipur, and also we get the Meghalaya, and they come far and wide. And what is unique about this project is that we do procedures for people who fall outside the radar of all healthcare systems due to the complexity of the solution. For example, this girl from Orissa. She's a migrant labor in Chennai. She got burnt with living conditions. And you see, their face has been stuck like this. The most horrific thing was their hands. That's the left hand and this is the right hand. This patient is totally dependent for all activities. It's a soul destroying situation if she has to depend on somebody for feeding and for her toilet activities. So the same patient, we have done some surgeries, we have treated her face, and then we have treated one of her hands. And over a period of 3 years, and all totally free to the patient. After we did one hand itself, she became totally independent. And now we know she's coming for the second hand. What makes this project unique is that we address the issue from start to finish. Usually in healthcare systems, where systems fail, is that we need to fill in the loop. I think we need to run a marathon, not a 100-meter sprint. I think not that we should address only one part of it. Unless we take the whole, that means it doesn't not work. For example, in this lady, see, you see her right hand, it's so bad, she cannot do anything. And you see her the left hand, I think the left hand is also, she cannot do anything. The same patient after multiple operations, because the left hand is working and the right hand is working. But then we gave her a vocational training, and now she is able to make a wage. She is able to earn a living, and she got married. I think we gave her just not hands, but a family and an vacation to go. And I think this is what makes this project unique. And this impact is higher when we treat a child. For example, if a child, if we just put her hand into a hot water, and then it became like this. That means when the right hand gets involved like this, the schooling stops. That means we are producing one girl child who is not going to study. I think that's the bad thing. So same child, I think after we did it, she puts it and then she starts the registration. She puts the first literary word she's able to write. So literally now we gave her first steps. Since the reputed organization is involved, long-term continuity of care is ensured. So when we treat this major burn, it's not a one-off situation. It's not like a cataract or a coronary bypass. You just fix it and forget. So here, people may have to come back again. For example, is we started treating this child as a one-year-old child in 2013. That's the child. The hand has become like this. We had to contract to release it on both sides. We do major reconstructive procedures, and that's the child. So that means now she's now going to start the school. His hand is nice. You do it. And that's the same child when he comes to 11 years old, when she comes back in 2023, at the time because of her growth, she gets a small band over there. And then in 2023, she comes to us and we treat the child. In healthcare projects, you need an address to come back to. That means they need to have a trust in the system and they have to trust in an institution. If it is not there, we may not fully utilize the work done, and sometimes the whole effort may be wasted. I'll give an example. So here is a lady whose hand has been very badly burnt, and look at her elbows, wrist, fingers, and all that. And then to get to this system, she requires multiple stages. And the whole effect is got only when you finish all the stages. She was a schooling going girl. And after we treated all the surgeries, she got a lovely handwriting. In fact, she writes much better than most of the doctors we have in a hospital. So this is achieved only after going through all the steps. So that's the reason we say they need to have a place where they can come back to. Point number four, we build trust about the project in the community. Say, here's the lady who got very badly burnt in the face. This also happens in acid burns. And then when we had a camp, she did not come to that camp. And then she suddenly came one day, late in the night, she came to the hospital. And then we asked her why we should not go to the hospital or why did not come to work. She told us we thought it is just be like yet another camp where people come, they promise, but they don't deliver. But then later on, we found that it happens in this hospital and it is free. I think that's the reason we came. So here, from there, we have gone to this stage, and then now she is able to go out. Previously, she could never venture out of the house, and because of her, there's another two younger persons also could not go out of the house. Sometimes what happens is if they are living in a rented house, the house owners will ask them to vacate the house. I mean, they cannot; they just become homeless. So from there, I think we have got here. I think it's entirely free. It was done totally free of cost. Five, we did not let formalities hinder our work. When anybody came, I think we didn't ask them now where they are from, how much they earn, and nothing. We feel very bad that already they suffered so much, and then we should not allow them to get bogged down by formalities. So we said people come from anywhere. I think we are able to reach far and wide. I think there's a lady from Uttar Pradesh who had a small acid burns to me. Actually, it's Maina. I think she came up like this after many procedures. So I think she continuously, her tears were welling up in her eyes. And that's the same lady how we have made her become. And then she's a good cook. And then after that, she got employed. And she's very meaningfully employed now. I think she sent us, so happily, she sent us her pictures over to us. The point number six is that we help people to integrate into society like no other. So here's this an example. Say is a man who got this, and because of this, he was not able to go out. And when you go to the places, if they give dates and dates and dates, you come again, come again. That means they feel They cannot go because they can't go in public transport to the hospital. That means they need to take a taxi or they need to cover their face. They can't do that. But once they go to a hospital, if they're not taken in on that day as they arrive, that means they find spending this money for the transport is a waste. So that means here, even when our hospital is so full, the patient comes with a burn deformity, irrespective of what's the situation is they are admitted. So we do them at the time of their choice and not at the time of our choice. So the same patient, we have made him like this. That's the way he was, and that's the way he is now. He is now gainfully employed. And then when this was a candid photograph that was taken by one of our social workers, this guy went out of our hospital and then in the just stepped out of the gate. I think he was taking a selfie of himself just to see how he looks. I think this is exactly now what we are trying to achieve. So what we can offer, I think, with captains, this thing is this. Our strength is that we can offer comprehensive, high quality teamwork in reconstructive surgery for major burn victims. We have got a good track record. It is world renowned. Team is capable enough to scale on demand. I think we can do any number. Having been doing it for people needing it for over 1,500 patients over the years and nearly 1,000 patients under the banner of Hope After Fire, I think we're fully confident that we could do more. The limitations, what people might say, is that these can be done only at Coimbatore. I think we can be coming and doing it other places because it needs repeated observation, repeated multiple procedures. Major deformity correction needs stages to do and it needs teamwork. But I think that's a small limitation because we have done for patients as far as Meghalaya and Manipur. And then we can do it together. So if doctors, I think particularly somebody the head of the Department of Plastic Surgery at the Sanjay Gandhi Institute, Dr. Arun Bhatnagar, or somebody, all of us, all of them know us. If they can choose very severe cases and send them to a place, we can do it entirely free to the patient on the same model as Hope After Fire. Language and food will not be an issue. I think people who speak Hindi will coordinate. In fact, now 30 to 40% of our patients from out of state. Another area where we are acknowledged experts are the reconstruction of electrical burns circulate to the hand. In this again requires major amount of work, and they are all young people, and from total dependence we can make them independent. I think this again we can do. And we can do it silently. I don't think we need any publicity because it's from doing from one state to other. I think we can do it silently. We don't need any publicity. You please just send them and we'll send them back happy and better and ever grateful for the initiative. Whereas the test cases, I think you can choose and send 2 or 3 patients in the beginning. We'll receive them in the railway station or in the airport. And gradually we can appoint a licensed person at both ends. We'll operate patients at their convenience and not give dates, and then we'll send them back. And thank you so much, sir, for giving us a possible opportunity to serve. I think we are great friends of great disciples of Swami Vivekananda, who said, "Now they alone live who live for others." Thank you so much.